All right, I think we will get started. So thank you to everyone for joining this afternoon or this morning. We welcome you to CSAAH's 11th Biennial Asian American, Native Hawaiian, and Pacific Islander Health Conference. My name is Jennifer Wong. I'm a program manager at NYU Langone within the Section for Health Equity and with NYU Center for the Study of Asian American Health. And I will be your MC or your host for today's sessions and tomorrow as well. We're very excited to be gathered and meeting with all of you and want to recognize first our longtime partners and colleagues at the Asian and Pacific Islander American Health Forum, who are graciously co-hosting this event with us over the next 2 days, as well as our friends at AARP for their much appreciated sponsorship of this year's event. I'm going to drop a link to our website and the program booklet into the chat as well. And then I'd also like to turn it over to my colleague, Dr. Simona Kwon. Hello. Dr. Simona Kwon is an associate professor in the Department of Population Health. She is the vice chair for diversity, equity, and inclusion in the Department of Population Health and director of the Section for Health Equity and our Center for the Study of Asian American Health. And she is wonderful. So I'll turn it over to her.
Thank you, Jen, and thank you everyone for attending. Hello, I am Simona Kwon, the director for the Center for the Study of Asian American Health, which is housed in our Section for Health Equity in the Department of Population Health at NYU Grossman School of Medicine. It is with immense pleasure that we at CSAAH and our co-host, the Asian and Pacific Islander American Health Forum, extend our warmest welcome to each and every one of you to attend this, our 11th Biennial Asian American, Native Hawaiian, and Pacific Islander Health Conference. And with a big thank you also to our conference co-sponsor, AARP. Today and tomorrow, collectively, within the conference sessions, we will explore the theme, Sustaining Momentum, Community Action, and Health Equity Research. And as we gather here today, we embark on a journey of exploration, collaboration, and innovation. The conference serves as a platform for us to present a diverse program with our talented and esteemed speakers and sessions to invite conversations on how to collectively navigate forward to reflect, activate, build, and sustain community-led, community-centered research to advance health equity for Asian American, Native Hawaiian, and Pacific Islander populations. We were established in 2003 and funded across multiple cycles as an NIH, National Institute on Minority Health and Health Disparities Center of Excellence. CSAAH is committed to understanding, addressing, and reducing Asian American health disparities through rigorous transdisciplinary and community-engaged research. And since 2007, we have partnered with the Asian and Pacific Islander American Health Forum to advance research and support health equity outcomes across Asian American, Native Hawaiian, and Pacific Islander communities. Thank you all for joining us at our 11th Biennial Conference. I'm happy to turn over the conference to my colleague, Dr. Ðoàn, Assistant Professor in the Section for Health Equity and affiliated CSAAH faculty member.
Hi, everyone. Good afternoon or good morning. I'm really happy to be able to kick off this 11th Biennial Conference. I'm going to share screen. I started first engaging with leaders in Asian American health research over 10 years ago during my MPH program. Many leaders who are moderating or speaking during the conference for the next 2 days. As an MPH student who didn't know anything about what it meant to be in academia or research. So I'm so very happy and also nervous to be able to speak at this conference over 10 years later, but also be able to share the work that I've been involved with to set the stage for the conference. So to provide a brief background of what I'll be covering, as you all know, the monolithic representation of Asian American populations has maintained assumptions that Asian American people are not burdened by health disparities and they don't experience social and economic inequities. However, we know that that story is much more nuanced. While I was in my doctoral program at Oregon State University, which is a predominantly white institution situated in a state with a legacy of racist legislation, excluding Black and communities of color from entering the state, it really shifted what I thought was common understanding about the diverse Asian American community. So my experience in Oregon, along with a summer fellowship at the National Institutes of Health, really emphasized for me that it's not just the general society who doesn't believe that Asian Americans experience health disparities. It's these larger systems that have created and continued systems of harm that then prevent us from eliminating health disparities in Asian American communities. So to the left is a seminal article by Dr. Chanda Ghosh, who found that 0.2% of federal health grants, like those from the National Institutes of Health, Centers for Disease Control and Prevention, that involved Asian American, Native Hawaiian, Pacific Islanders between 1966 and 2000, made up 0.2% of federal grants, and that only 0.01% of articles during that same period mentioned Asian Americans and Pacific Islanders. In 2019, I conducted an updated review that again found that 0.17% of NIH funding has been allocated to behavioral and epidemiological studies involving Asian Americans and Native Hawaiian Pacific Islanders over the last 26 years. Again, highlighting decades of underinvestment for Asian American and NHPI health research. This also, although this review was only on National Institutes of Health funding, this underinvestment also aligns with what we see for philanthropic funding for Asian American communities, the representation of Asian American people in the news media, and even funding from New York City agencies for Asian American serving organizations. This research has then continued to evolve to understand what are the contributing factors to low funding and what are actionable solutions for understanding how we can truly achieve equity for Asian American as well as Native Hawaiian Pacific Islander communities. So the article to the top is work led by Dr. Stella Yee, where we discuss 3 racialized stereotypes for Asian Americans: the model minority, healthy immigrant effect, and perpetual foreigner, and how they impact data and inclusion of Asian American communities in research. These 3 stereotypes fuel both societal and scientific perceptions that Asian Americans do not experience health disparities, which then exacerbates the exclusion and misrepresentation of Asian American experiences in all stages of health research, from study design, data collection, data analysis, and reporting. And I often think about who else is missing, excluded, or othered in research, and really what are our collective opportunities for greater inclusion and inclusive health research. So during the last several years, the COVID-19 pandemic really emphasized the need to reform policies and practices that perpetuate structural racism and poor demographic data collection, as well as the urgency for our communities to get time-sensitive data during public health emergencies. In these articles, we push for more research investment in multi-sector partnerships to identify and address the complex health inequities and systems of exposure that impact Asian American communities. And we know that the multi-level and intersecting COVID-19 pandemics on Asian American communities, the research has found, we've heard from community stories, that there's chronic stress felt from fear of racism and discrimination. There's worsened mental health. There is loss of security and sense of belonging in the communities in which we reside. And when we talk about anti-Asian racism, it's not within a vacuum. It's within the context of these broader structures of race, gender, immigration status, socioeconomic conditions. All of that impacts Asian American people as well as their health outcomes. And it's important to acknowledge that anti-Asian hate is really not an exceptional case, but it's deeply linked to these broader conversations we have been having and need to continue to have in the wake of the Black Lives Matter movement, the genocide of the Palestinian people. This is very much connected to history, and we really need to think about how this racism and violence is not only impacting the Asian American community, but other communities of color. Racism, xenophobia, and discrimination against Asian Americans, we have seen, is embedded in the current public health data infrastructure. And invisibility in research, again, is not just an Asian American problem. So To pivot now to the paper that I am going to discuss. This is a recently published article in the Annual Review of Public Health journal. Here are my co-authors, without whom this massive review and publication really would not have been possible. So this was an invited paper that was, the purpose was not only to summarize, but to think more deeply about the state of Asian American health research and where we want to go. So what we tried to discuss throughout the article was that advancing health equity for Asian Americans requires a new narrative and solutions that acknowledge our diversity, and that then can help us address discrimination, poverty, poor health outcomes. And the specific ask for this article was to explore and explain the basic demographic and epidemiological profiles of Asian Americans based on what is currently known about patterns of morbidity and mortality across the life course, and then the general picture of how health outcomes compare to the US white population. And we were also asked to then comment on strengths and limitations of available data sources and related gaps in understanding Asian American health. So as you might suspect, it was quite challenging to think through how best to do this. This is a massive review endeavor. And several points we wanted to clarify before we accepted this review was to really think about clarifying the comparison of Asian Americans across to a white reference group. So increasingly we're being questioned about, there's a question among health disparities researchers about why white populations are the dominant reference group in research, and if outcomes compared to white communities should even be the standard. The second consideration for this review was that there was a focus on Asian and Asian American people within the US and not on health on people in Asia, because as we all know, specific context and geographic location matters. So our approach to this review was to do a thorough search of the published literature, gray literature, and other seminal papers on Asian American health research. This was essentially a review of reviews. Dr. Alka Kanea and co-authors had recently published a report from the 2021 NIH workshop on knowledge gaps, challenges, and opportunities in health and prevention research for Asian American, Native Hawaiians, and Pacific Islanders. So we decided to do a review of reviews to understand the state of Asian American health research and where potential gaps were that also aligned with prior reviews of the landscape of Asian American health. So briefly, we included articles from the last 2 decades between January 1, 2002 to December 31, 2022. And we included 214 reviews in this study. So as you might expect, reading through 214 papers, took quite a while, and it took us even longer to figure out the best orientation to visually present the data, reflecting on the knowledge gained from the last 2 decades, and really think about the opportunities for Asian American research and practice. So this article summarizes information for the 11 topics listed here. This is just in alphabetical order, and then the number of reviews that we found are listed here. Throughout the article, we note 3 broad topical domains of research: general descriptive knowledge, factors impacting healthcare uptake, and then effective interventions. So we interpret these differences in topical plurality as it correlates to public health significance, available funding, and very loosely, the opportunities given the lack of interventions for several of the health topics. So the main topics for the review were cancer, cardiometabolic disease, mental health, and smoking and e-cigarette use. And these topics map broadly to funding from the National Institutes of Health, institutes and centers of who has funded health research. As you might expect, the best represented communities were the 6 largest Asian ethnic groups listed here, as well as English-speaking Asian Americans. In terms of the leading causes for morbidity and mortality, I only list 2 here. Cancers, particularly those of infectious origin, affect primarily East Asian American communities, and lung, breast, and colorectal cancer are leading contributors to morbidity and mortality. The next is poor cardiovascular and cardiometabolic health affects all Asian American communities, but the highest burden is observed among South Asian American and Filipino American communities. Across all health topics, we found a broad underutilization of health services. This included healthcare, cancer screening, formal mental health treatment, care following sexual trauma across all Asian American ethnic groups, which were driven by multiple factors, including cultural and individual stigma, language access, cultural norms and values, as well as physician-patient concordance with physician understanding. We found that often in discussions, family was very important. So family is of central importance to Asian American communities, but it's not typically de-emphasized in the US medical care across all health topics. We also described what characteristics of what effective interventions include. They often, as we might expect, were culturally and linguistically responsive interventions and had in-language and culturally appropriate health education materials, and often included multi-sector coordination along with trusted community partners. We also made recommendations to address the major findings of what we found across these three findings here. So who was represented in Asian American health research, broad underutilization of health services, and what is needed for effective interventions. So to be brief, there are opportunities to improve data collection and disaggregation of demographic data for Asian Americans, and to more critically evaluate who the comparison group should be. To address the broad underutilization of health services, we need to increase the bilingual and bicultural health workforce, as well as train diverse healthcare professionals on cultural humility and better incorporate these into healthcare practices. We also need to acknowledge the role of discrimination and internalized racism on mental health and healthcare utilization. For interventions, our recommendations include approaches that appropriately account for stigma across different health outcomes, acculturation, language preferences, health literacy, as well as cultural beliefs and values for specific ethnic groups. And there's an urgent need for robust longitudinal data. And as you'll see for the next 2 days, we are highlighting new and recent research that are building these robust longitudinal data sets that are opportunities for us to advance the needle towards Asian American health equity. So in terms of research opportunities, again, some of the priority topic areas I've already discussed, but future health priority should prioritize underserved and underrepresented Asian American ethnic groups, who might include low income, limited English speaking, as well as growing and emerging communities under this larger Asian American umbrella. More research is needed to understand the prevalence and co-occurrence of substance use, like alcohol and e-cigarette use, as well as mental health disorders among Asian American youth and young adults. And interventions, again, need to address stigma and anti-Asian discrimination. Asian American health researchers should be applying community-partnered research approaches and innovative survey science to more effectively reach these underrepresented or not represented ethnic groups. And we also need interventions to address sexual and reproductive health disparities, the consequences of trauma and violence, as well as a range of aging and Alzheimer's disease issues. So looking forward, as we look ahead, there's still a lot of work that needs to be done. Federal efforts such as the 2030 census, the NHLBI funded Mosaic cohort that was funded in August of last year, the newly funded National Cancer Institute Aspire cohort, we must be designing future and current health research with health equity and diverse Asian American communities in mind. Otherwise, data will continue to reproduce harm to Asian American communities, particularly for those that are small and emerging communities. designing these efforts with health equity in mind will also be more robust in their usefulness for Asian American health research for decades to come. I think equally important is to consider throughout this conference is how we shift the narrative to health differences because of Asian race or Asian ethnicity to interrogation of how racism creates and maintains inequities for people racialized as Asian. So our current interpretation of racial disparities in health have been ahistorical and atheoretical and really ignores the processes for racialization that causes health disparities. By better understanding and these complex systems, we can then better address and eliminate health disparities for Asian American people. I do want to acknowledge that the current body of Asian American health research is a culmination of decades-long advocacy and dedication from Asian American community leaders, researchers, and allies, including all of you, for Asian American visibility. And we acknowledge that there are major scientific contributions that have been made to address health disparities. And as we look ahead, the next 2 days are filled with more opportunities to make these major shifts and contributions to health equity. These collective efforts are still needed, particularly now to dismantle current research paradigms towards one that is predicated on participatory practices that prioritize community-driven research and engagement. So with that, I'll end with some closing thoughts. The changing demographic and health profiles of Asian American communities require acknowledging and addressing the insidious power structures and biases that hinder the advancement of Asian American health equity. We must recognize the unique needs of communities that are experiencing racism at the individual, institutional, and structural levels in this country and by this country. So just as with Native Hawaiian Pacific Islanders, Black, Indigenous, and other communities of color, Asian Americans suffer from discrimination, high rates of uninsurance, challenges in accessing health and mental health services. So how can we critically engage in these collective efforts to address racism and discrimination moving forward? And how can we best support culturally grounded, community-driven research efforts? Lastly, how can we foster racial solidarity and work in allyship with interfaith and historically marginalized and excluded communities, community leaders, and advocates who want to advance health equity through changes in the way data are collected, analyzed, and reported? So I hope the next 2 days provide an opportunity for you all to take stock in where we are and to continue generating momentum for the work that needs to be done ahead. So thank you all. Thank you to NYU CSAAH, the Health Forum, and conference organizers who were instrumental to bringing all of us here together today. And thank you all for being here with us and your partnership in this important work.
Thank you so much, Lan. Thank you, Dr. Ðoàn, for providing this informative context and overview of the current research landscape. I think it's really important as we continue to do the work that we're doing and think deeply about the state of Asian American health research and where we want to go in the future. So thank you for highlighting that and sharing it so succinctly. I agree with you. I look forward to continuing to learn from today's speakers and from our speakers tomorrow in the spirit of this year's conference theme of sustaining momentum, community action, and health equity research. So with that, I'd like to thank everyone for joining and to kindly stay on as we get ready to start our first official session, panel session, which will be on this same line. So if you just hold 1 second, and yeah, we will get started and just make sure all of our speakers are on the line.